what persists? Racial disparities persist. And this is really a humbling thing. I look out at this crowd today, and it's mostly a white crowd. But this is a significantly minority problem. This is a problem for African Americans and American Indians in our state. We still suffer from the long-term sequela of our history as a nation. And there is no way that one can look at this population today and say we do not have some roots in discrimination and racism. These racial disparities persist. Multiple health issues persist. And we'll talk about those in just a minute. Barriers to obtaining and maintaining housing persist, and domestic violence among women and children. It's been a thread that has run through all of our studies, and it persists. Finally, a history of placement and incarceration. I was talking with one of the DOC staff just before the meeting started today. We have some, I think, very useful information for DOC. That's Department of Corrections, related to what's going to happen when we empty out those jails and prisons. And in fact, 90% of everyone that goes in is still going to come out. And if we do not make some provisions, they are going to be increasing the ranks of our homeless populations. So here are the racial disparity figures. I'm just going to point out a couple of these. We were down to the wire in presenting this, and I have to say Marilyn Conrad did an unbelievable job of pulling our PowerPoint together. But as this was one of the ones we probably would have improved as a visual, because we don't like to put that many numbers on the page. But just to point out a couple, if you look at the homeless adult population, in Minnesota, 4% are African American, and the homeless youth population in Minnesota, 12 to 17, 6% are African American or black. In the homeless adult population, 41% African American or African people of African descent, and in the minors, 43%. Similarly, in the American Indian population, we see less than 1% for the state population as a whole, but they represent 11% of the homeless. And in greater Minnesota, they represent almost 1 out of 5 homeless people. These racial disparities are significant. They are important. They represent a significant issue for us to resolve. And it's not simply part of providing affordable housing and providing services. It's a part of addressing the history that got us here. Serious health issues. This is our famous Ellen's interlocking circle diagram. We did this one year, and so we always go back to Ellen to put new interlocking circles together. It really does help visually, though, to understand what's going on. So 55% in the 2009 study report a serious or persistent mental illness. We used national health interview questions for this. We asked the question, have you been told by a doctor or nurse within the past 2 years that you have one of the following illnesses? And then we read that list of illnesses. That number has gone steadily up since the beginning of the survey. Started at around 25%, now up to 55%. So when I talk about increasing concentration of distress, that's part of what we're talking about. Chronic health conditions. 46% of the population reporting chronic health conditions. And then substance abuse disorder, 23%. Reporting that they have a substance abuse disorder told by a doctor or nurse within the last 2 years. So, so this is the figure that is of some interest. 26% of the individuals in our sample have none of those disabilities. Ellen, in an endless desire to cram my head full with new facts this morning, had one new fact for me, and I want to share it because I think it's a really important one. Back when Governor Pawlenty was the Republican caucus chair, he had asked a group of homeless advocates, and probably some of the people in this room were part of that group, to come in and talk about what would it take to solve this problem. And the Republicans, I think, wanted to get a foothold. That foothold isn't really quite where we want to see it yet. But at that time, we were looking at calculations of absence of barriers. And at that time, caucus leader Pawlenty asked, what percent of the homeless are good to go? In other words, if we just had housing and we didn't have, and we weren't worried about mental health, and we weren't worried about serious physical illness, we weren't worried about chronic brain injury, what percent of the homeless are good to go? And at that time, could we get them in housing? And we were reporting 24 to 25%. We ran the identical analysis with the same variables. Ellen ran it for me this morning, and that is about 9%, 9.5%. So This is really part of what we are facing when we are trying to tackle this problem, and why it makes people like Laura's job so hard. And Liz Coopla, who's also on our panel, advocates for the homeless and people in charge of ending homelessness for the state. It's part of what makes our job so hard, that we have this increasing level of concentration of distress, and it becomes more difficult to address a diverse set of issues and barriers and health problems to try and provide the range and the particular configuration of services that are going to make it possible for people to stay in housing. Other types of barriers include housing barriers. 43% reported as a lack of job or income as a significant barrier to housing. Lack of affordable housing, unable to find affordable housing, that's what they're looking for, able to look for housing, even in the situation where they can look for housing. And other barriers include, and there are not small barriers, criminal background, credit problems, court eviction or bad rental history, and no local rental history. When we combined a couple of variables this year to try to get a picture of whether or not that court eviction and foreclosure has begun to affect the population, it was pretty clear that there was a bump of 8 to 10 percentage points in the percent of the population that were affected by this issue of foreclosure and eviction. It's a little hard to estimate exactly, but it's clear that there is some effect from that in this population. Domestic violence. This is an issue we all wish would go away, but apparently we don't wish enough, or we don't stand up for it enough, because we still have 48% of women in our sample who report that they stayed in an abusive relationship because there was no other housing. 53% reported being physically or sexually abused as a child or youth. Only 10% of those reporting violence in their background were in battered women's shelters, which means that we are catching, in a variety of programs outside of battered women's shelters, people who have experienced domestic violence. In our study this year, 29% reported fleeing domestic violence as the principal cause for being homeless. That's down a little bit, a few percentage points from what we found in 2006. Still, the issue has not gone away. It's varied a little bit, but the issue is persistent throughout this population. Violence among youth, also a significant issue. 42% of youth, and I think, Michelle, are we talking about the total group of youth?
Yep.
This is the 11 up to 21. 42% reporting being physically abused, and you can see the male and female breakdowns there. We first put boys and girls, but I guess when you're talking about 19 and 20 and 21-year-olds, they don't like to be called boys and girls anymore. But these are 48% of females, 32% of males report being physically abused. 27% sexually abused, and here the numbers are more disparate, 39% of females, 9% of males. And 30% report staying in an abusive situation because there was no other housing for them. High incarceration rates, I talked about this briefly. Now we're up to 47%. And you can see that in the 06 study, we're not really talking about a very big difference from the 06 to the 09 study. But 47% now report that they've ever been in a corrections facility, and 17% report that they've been released. So that's about 1 out of 6 people who have been released from a correctional institution in the last 2 years that are now part of our homeless population. And this makes the issue of safety in shelters significant. This makes the issue of trying to guard for safety and to be able to provide services in an environment which feels safe to people a significant barrier. Other placements. 58% have had at least one of the following social service placements. This is in our adult population. Drug or alcohol treatment facility, foster or group home, halfway house, or mental health treatment facility. I want to pause here for just a second about this. Because this is a study relying on deep-end interviews with individuals who are homeless, conducted by volunteers who give their time to do this one time every 3 years. We do tend to emphasize here descriptive characteristics of the people that are homeless, and don't talk a great deal about what Paul was talking about previously, which were a variety of the systemic and cultural barriers and the issues that people face when they are homeless. So I don't want this to be construed as saying we've got just people with all kinds of problems and there's nothing to be done. I'm not saying that at all. I'm saying we have to be realistic about the barriers that people have. We have to be realistic about bad starts in life that some people begin with, and have trouble overcoming. And we have to look at those barriers squarely if we are going to have ways of addressing them that actually match the needs of people in this population. Geographic distribution. This is an interesting finding, and I'll try to explain it a little bit. Over the years, from 1991 to 2009, you see we've dropped from 80% of folks that were identified and surveyed in the metro area down to 68% in the most recent survey. And similarly, over the same time period, 20% found in greater Minnesota, up to 32%. Now, two things are going on. One is, I just think we're getting closer to the real picture. And that is because over the course of the study period, which is now almost 2 decades long for the statewide portion of the study, we have gotten better at carrying out outreach and being able to identify individuals who have experienced homelessness in greater Minnesota. We also have a group of advocates and outreach people in greater Minnesota who have really ramped up their efforts to help us find individuals who are experiencing homelessness. So part of this is not that those people didn't exist back in 1991. We think that we are now, with our methods, better, a sort of improved version of conducting outreach so that we can find them. I would guess, and we know also just from the data on where was your last housing, that there is movement back and forth. That a portion of people come to the Twin Cities from greater Minnesota, and that's where they're found. But there's also a portion of individuals who become homeless, led their last housing in the Twin Cities, and now are in greater Minnesota. Either because of a family connection or a friend or someone else that can provide some kind of support. And we cannot underestimate the importance of that kind of informal support for a person trying to get out of the situation. Regional differences. Greater Minnesota has fewer shelters. And if you look at the distribution of where we found people in these two portions of the study, in the metro area, 37% of the homeless were found in emergency shelters compared to only 17% in greater Minnesota, where there are fewer shelters. And our outreach efforts, 48% of our population were found through outreach in greater Minnesota compared to 20% in the metro area. So again, reinforcing this, that when you don't have a lot of provision of facilities and services, it's a different, it requires different methods of finding and identifying and surveying individuals. Most are from Minnesota. I think people often look to Minnesota and they say we are a resource-rich state, we are a service-providing state, and I think we still like to think that, although some of us would maybe say that the safety net is maybe not quite as strong as it has been in past years. And 77% of adults that we found have lived in Minnesota at least 2 years, and that's up from 61%. So that means we have a more homegrown homeless population. 1/3 of the rest of those folks that say that they have moved here within the last 2 years actually had lived in Minnesota previously. Similarly, 80% of youth have lived in Minnesota at least 2 years, and 70% of youth report that they grew up in our state. So here's the diagram that Paul started out with, talking about risk factors, health issues, economic conditions, systemic barriers. It's really important to go up from this level of detailed characteristics of individuals in the population and ask ourselves, what about things like will, that Paul was talking about, the will to address this problem? What about access to health care? What about access to affordable housing? What about discrimination? What about other aspects that may affect an individual's opportunities to escape the situation of homelessness? And then focus on the pathways out. And there are two kinds of things that we can act on in this. We can act on the entry points. We can act on those ways in which people become homeless and think about the prevention strategy. And we have many prevention strategies. I'm sure Laura, when she does some summing up from the panel discussion this morning, will talk about some of the programs that we have in Minnesota that help us begin at the very earliest point to try to intercept someone from becoming homeless. But we also have to, with this concentration of distress and this growth of the longer-term homeless, we have to think about what are the range of solutions necessary at the further end to be able to address this. Prevention, I just mentioned briefly, rapid response to recent homelessness, a significant potential benefit to those who are in the situation and have maybe recently entered the situation, and efforts to address long-term homelessness, which actually require a bit more in the way of resources and I think a significant range of different types of provisions of resources in order to be effective.